Hi there, my name's Martin Stone from Switch On Health, and thank you for joining me for this presentation on health fund rebates for natural therapies. Is private health insurance worth it? Australia. Now, please don't be put off by the length of this presentation because I promise I will put the conclusion very near the beginning of this presentation before I then go into a much more detailed discussion. I will also put in chapters, so you're welcome to skip ahead to the bits that interest you if you want to. However, I do encourage you to watch this presentation in its entirety because I believe every Australian should know this information. I think a lot of it is not known by a lot of people. I think you will find this very interesting, and I can pretty well promise you will be more informed about these issues than before watching this video. So I do encourage you to watch it in its full entirety. So here's an overview of what we're going to be talking about. First of all, I'll just have a couple of disclaimers. I'll then do a brief history of rebates before I give you the bottom line up front. Okay, so that's going to basically be the conclusion of the presentation. I'm then going to talk about how we get to that conclusion by going into a very detailed discussion on rebates, what they are, do they make sense? A detailed discussion on private health insurance in general. At the end, we'll get into more detail about rebates specifically for natural therapies. Will you be recognised as a provider for rebate purposes as a Switch On Health graduate? And the potential impact on your business as a practitioner. Pretty good, right? So here we go. First of all, the disclaimers. So if you are studying with Switch On Health already, you may have worked out that we don't like to tell you what to think or how to practice, okay? But what we do is we really attempt to empower you to be able to think critically and to make a fully informed decision. Now, throughout this presentation, we make no recommendations as to whether you should hold private health insurance or not. That is entirely up to you. Everybody's circumstances are different, and you'll just have to make up your own mind. But as I said, having watched this presentation, I think that you'll find there's a lot of information in there that really does empower you to make a more informed choice around this. Now, this presentation has a lot of references. It is very well backed up. We do attempt to inform you of all relevant issues. A couple of things to note. This presentation is being shot in May 2025. This is an evolving situation. By the time you watch this presentation, things might have changed. Now, even though there is a lot of fully referenced information in here, some of this content will be my opinion, and it will be quite clear to you when that is the case. So, quickly, a brief history of rebates. So, health fund rebates for most natural therapies were removed in 2019. Nutrition and remedial massage stayed as rebatable therapies, but funnily enough, not all funds actually rebate nutrition, even though they can if they want to. So why were these rebates for natural therapies removed? Well, this was based on heavily flawed and biased research, because it wasn't really research, heavily flawed and biased research by the NHMRC, the National Health and Medical Research Council. I think this research cost about $1 million from memory. Now, we have excellent coverage of this in our HOM 102 subject, thanks to Christina Boyd, who is a homeopath that authored that subject for us. So if you do want to know more about that research that was conducted by the NHMRC, I do encourage you to enroll in that subject, HOM 102, because we do an excellent coverage of that particular issue. Thank you, Christina. Now, with regards to homeopathy, this research was so flawed in its methodology, it became the subject of a complaint to the Commonwealth Ombudsman. And the Ombudsman took 7 years before coming to the conclusion that they couldn't really reach a conclusion. Now, back to 2019, when health fund rebates were first removed in April, I think it was, exactly 1 week later, I think it was actually 6 days later, Health Minister Greg Hunt, rhymes with, well, he backflipped and said, you know what? We're going to have a review into this to remove the rebates. Isn't that amazing? I can't think of many times in government when this has appeared, when they've spent public money, they've put something into place, and then within the space of a week, they've decided maybe we should have a second look at this. So this is when the NTREAP review started, Natural Therapies Review Expert Advisory Panel, and another $2 million of taxpayers' funds was allocated to that. Now, a lot of people in our profession have been working extremely hard on submitting evidence as part of this NTREAP review, so a big shout out to all of those that you were involved in that. Well done, fantastic effort. Now, the NTREAP review has now concluded, and as of 2025, the Health Minister has accepted the recommendations of that review, which is to bring some rebates back to the health funds. Now, these include naturopathy and Western herbal medicine. It does not include homeopathy. Okay, so bluff, bottom line up front. So are rebates definitely coming back, and will Switch On Health graduates be able to provide them? So this really is why we decided to do this presentation. We've recently been fielding a number of questions from people, not just studying with us, but from the profession at large. People have been asking us these sorts of questions. So at this point in time, nothing is definite, okay? We do not have a crystal ball. We can't see the future, but in my opinion, and based on my experience, I would say the most likely scenario is that A, health fund rebates will return for naturopathy and Western herbal medicine. B, Switch On Health graduates will not be recognised as providers by the health funds. And C, this is unlikely to make a big difference to your success as a practitioner. Now, as I say, nothing is known for certain yet. This is just what I think is the most likely outcome, but anything could happen. Okay, so what I'm going to do now is get into a much more detailed discussion about private health insurance. If you want to know more about natural therapies specifically and what's on this slide, you are welcome to skip ahead to the appropriate chapter. However, I think that you will find what's to come very, very informative. So first of all, what are health fund rebates? Well, a rebate takes the form of cash back or discount on a service, and that service could be dental or osteo or nutrition or massage and so on. So these rebates therefore encourage people to purchase that particular service, osteo, acupuncture, massage, etc. And they also make private health insurance a bit more attractive than it would be otherwise. Because private health insurance, it could be a bit like death insurance. You know, it's something that you think, well, it's probably a good idea to have it, but I kind of hope I don't need it. But if you can get a rebate for getting a massage, well, that makes private health insurance a little bit more sexy, doesn't it? Okay, but is private health insurance really worth it? Well, private health insurers are private businesses. And as a private business, they are there to make money. So what this means is they are going to take more money from you than they give back. Okay, it might sound like I'm saying really obvious dumb things here, but I think we need to remember this. So just as an example, picking on Medibank Private because they're our largest insurer in Australia, so they keep approximately 10%. So for every $100 they collect in insurance premiums, they pay out approximately $90. And the rest, of course, is their profit, which they're entitled to as a business. In the last financial year, that 10% equated to approximately $714 million. So first of all, we've got to ask ourselves, well, if I'm paying for something and I'm getting less back, is it really worth it? Now, I don't actually have children, but you can see a photo there of my little fur baby boy. And when I first got my darling little boy in 2019, I looked into pet insurance, first pet I've ever had. And when I looked at the time from memory, pet insurance was going to cost me about $700 a year, and I was going to get about $300 back from vet visits and so on. And I kind of thought, well, is it really worth it? You know, why would I spend $700 to get $300 back? maybe I should just stick that $700 in the bank instead. So here we go. Just, the first thing to remember is private health insurance. Business is private, they're to make money. On the whole, they're going to collect more from you than they give back. Now, complementary medicine has a vastly better cost-benefit ratio than modern medicine. Now, there's a report here from 2014 that estimated that every $1 that you spend on complementary medicine will save about $8 in modern medicine. Now, I'm going to suggest that that figure of 8 times is actually quite conservative. I think the answer, how much more effective cost-wise is complementary medicine than modern medicine, I'm going to say it is close to infinity. And if you think that's a bit of an outrageous statement, I would encourage you to study homeopathy with us, and you will start to see why I believe that is possible. So does private health insurance make financial sense? Well, maybe it does. If you have known chronic medical conditions, if you anticipate medical expenses in the near future, maybe if you have children because they get into all sorts of trouble and they can be expensive, maybe private health insurance makes sense for you. Maybe it doesn't. If you're reasonably healthy, if you do not anticipate medical expenses in the future, if you've got money set aside for when something bad might happen, well, maybe you don't need to spend the money on insurance. It's probably going to give you less back. A good question to ask yourself is, are you better off spending your money on staying healthy with complementary medicine, which is a much better cost-benefit ratio, instead of insurance? Are you going to be health-oriented, or are you going to be disease-oriented? It's a little bit of a shift in the way you think, a little bit of a shift in your mindset. Do you live in fear? Do you think, I better have insurance in case something really bad happens to me? Or do you think, what, I'm not going to spend money on private health insurance. I'm going to spend money on staying healthy with complementary medicine, and that's going to decrease the chances that I would ever be in an insurance claim kind of situation in the first place. And it's going to be more cost effective for you to do that in all likelihood, because complementary medicine has a better cost-benefit ratio than modern medicine. All right, we better have a look at a little bit of terminology. So rebate, as we said, cashback or discount on the service. It may take the form of, you pay the full amount and then you get a bit of cash back, okay? It may take the form of you pay something and then the rebate is applied to future payments, so you don't have to pay as much in the future. Or, quite commonly, it'll take the form of an immediate reduction on how much you pay. So instead of paying $100, you might pay $90. Now, there's 2 types of rebates we're going to talk about in this presentation, okay? Now, the one that most people ask us about is a rebate on a service such as naturopathy or herbal medicine, okay? But there's another type of rebate which comes first, and that is the rebate on private health insurance premiums. A premium is what you pay for your private health insurance. Now, most people, they're interested in the second one, but really, the first one, in my opinion, is much more important. I think we really have to understand the first one before we can even have a discussion about the second one. So, if I was doing this presentation in front of a room full of people right now, I would say, stick your hand up if you have private health insurance. By the way, my hand is not going up at this point. I've never held it. So I would expect, a number of hands to go up in the room. And then I would say, hands up if you are paying for private health insurance. So first one, hands up if you have it. Second one, if you're paying for it. You'd think that the hands would be pretty much the same, but in reality, everybody's hand should be going up for the second one. So did you know you are paying for private health insurance, whether you have it or not? Now, to understand how this works, we need to know a little bit about the history of private health insurance in Australia. So the uptake of private health insurance increased massively in the early noughties, following policy changes by the John Howard government in the late 1990s. In fact, in a 6-month period between March and September of the year 2000, the number of people with private health insurance increased from 32% to 46%. It's almost a 50% increase in a 6-month period. Now, I would say if you were a private health fund, that was a pretty good year to be in business. So the Howard government wanted to decrease public expenditure on Medicare by facilitating an increase in private health. And the rationale given for this was that it was going to take the pressure off of our public health system. You know, we can relieve that burden on our public hospitals and so on if more people have got private health insurance. Take one for the team, right? Do your right thing as a good citizen. So 32% to 46% in a 6-month period. Well, that's pretty impressive. There must have been some pretty good policy there, right? So how did the Howard government encourage so many people to take up new insurance so quickly? Well, they did this using what's called the carrot and stick model. I'm sure you're familiar with it. So the carrot is dangled in front of you to encourage you to do something. That's your little sweetener. And the stick, well, that's what you're going to get if you don't do it. Okay? So carrot, stick, positive encouragement, and stick, punishment if you do not do it. Now, a colleague of mine pointed out to me the other week that the funny thing about the carrot and the stick, you never actually get the carrot, do you? It's always there, dangling in front of your face, but no matter how far you move forward, it's still there, just out of reach, tantalizing, teasing you. So that's the carrot and the stick. So let's have a look at the carrot first of all. So the government subsidized private health insurance premiums by 30%. This is the rebate on your premium. That's the first rebate we're talking about, that we're going to talk about quite a bit. Okay, so for example, if your health insurance costs you $1,000, you pay $700. The actual cost of private health insurance is more than the premium you pay. The government pays the rest of it. And how do they do that? Well, they do it from our taxes. So this means your private health insurance is more expensive than you think, because what you don't pay for it directly, you pay indirectly via your taxes. You may think that your insurance is costing you $700 a year. It is actually costing $1,000 a year. You're paying $700 directly, and the other $300, you're still paying it, but you're paying it via the collective tax pool. And if you do not have private health insurance, well, guess what? Your taxes are helping to pay for it for other people who do hold private health insurance. So hang on a minute. I thought private health insurance was private. Okay, well, it turns out that some of it is supported by public money, taxpayer money, public funds. Okay, so a portion of the tax that all of us pay, public money, goes straight into the pockets of private health companies, private insurance companies. Well, how's that for looking after the top end of town? So, I call this picture Spot the Difference. Two men in suits here. So on the left we have former Liberal Prime Minister John Howard, who came up with this scheme. And on the right, gazing with adoration at his idol, we have wannabe Labour Prime Minister Bill Shorten. Now, Bill Shorten, in the year 2019, when everybody actually thought it was in the bag. Everybody thought Bill Shorten was going to be the next Prime Minister. And in his campaign, he repeatedly used this expression, the top end of town. He kept accusing the Liberal Party of looking after their mates in big business, looking after the top end of town. He used that expression over and over and over. Now, funnily enough, the one thing that was not on Bill Shorten's agenda was getting rid of that policy of taxpayer money going into the pockets of big business. That was not on his agenda. Okay, so Bill Shorten accused the Liberal Party of looking after the top end of town. He was quite happy just to keep that arrangement going. So, if we're spending this much money on health insurance premiums via rebates, is it good policy? Well, rebates paid to the Australian government, paid by the Australian government to private health insurance companies as of 2025 is approximately $7.6 billion per year. To give you an idea, just 4 years ago, it was $6.7 billion, so that's a $900 million increase in the space of 4 years. So, we kind of hope that if we're spending that much money on something that is actually worth it and that they're doing what they're supposed to be doing. Well, some researchers in the University of Melbourne have looked at this. This is in the year 2023, and they concluded rebates are likely to cost taxpayers more than they generate in savings, and are largely windfalls to those who would privately insure anyway, often those who are financially better off. So, of course, the next question we've got to ask ourselves is, well, if we're paying more, if it's costing us more than it's actually saving us, well, what if we just got rid of the rebate? What would happen? And this is what they said about it. Then there's the impact of scrapping the rebate, people dropping their cover and putting more pressure on the public system. Earlier this year, we found private health insurance had minimal impact on reducing waiting times for surgery in Victorian public hospitals. So scrapping the rebate might have minimal impact on waiting lists. Taken together, the billions of dollars a year the government spends to subsidise private health insurance via rebates might be better directed to public hospitals and other high-value care, including primary care and preventive care. Now, I'm very happy to see that they had preventive care in there because, as I said earlier, every dollar spent on complementary medicine, which, we're all about prevention being the best cure, well, that's going to save the medical system, the public healthcare system, a lot more dollars. So what we can see is rebates are likely to cost us more than we actually get for them, and if we got rid of them, well, we'd probably be better off. So we've got all this government money flowing from the public purse into private companies. Where government goes, who follows? So $7.6 billion a year in rebates and growing. What do you think has happened to the price of private health insurance with the government subsidising it? Do you think that over time, do you think that the cost of private health insurance would have decreased or maybe might have gone up a little bit because the government's paying for some of it? Well, let's have a look at the data. Okay, so from the year 2000, when all of this started, pretty much, through to the year 2025, Medibank Private, so the cost of their insurance increased by about 234.8%. That's a compound annual growth rate of 4.95%. If you're not sure what a compound annual growth rate is, I'll give you a very quick example, okay? Let's say you've got $100 in a bank and that bank is paying you 10% interest, okay? So at the end of year one, you've earned 10% of $100, which is $10, okay? So you've now got $110. At the end of year two, you're getting 10%, not of 100, but of 110. So at the end of year two, you're getting paid $11, which is 10% of 110. At the end of year three, you're getting paid 10% of $121, which is $12.10. Your balance is now $133.50. So in effect, it's interest on top of interest, okay? That's the compounding effect. So the compound annual growth rate of 4.95%, that means on average, obviously some years they put it up or by more than other years, but if they put it up at 4.95% every single year, exactly the same, this is how much your cost would have increased by over that 25-year period. The cost of your insurance has gone up by 234.8%. Now, how does that compare with inflation? So the inflation rate over that 25-year period has been 2.78%. So inflation, 2.78, cost of insurance, 4.95%. That's a difference of 78%, almost double. So that means that the cost of your insurance is increasing over time at almost double the rate of inflation, getting kind of expensive, right? Now, interestingly, if you look at the numbers on this slide, you can see that 2.78 for inflation, 4.95% for the cost of the insurance. Well, 4.95% is 78%. It's not quite double the inflation rate. However, cast your eyes to the left. Over that 25-year period, inflation, on average, things now cost 98% more. Your insurance, 234% more. So why is the insurance more than double inflation? Well, that is the effect of compounding. All right, let's get back to the carrot, this nice juicy carrot for the rebates. Okay, so in 1999, when this was first introduced, there was a flat subsidy, 30% on your private health insurance premium. In 2005, that rebate increased to 35% if you're aged between 65 and 69, and 40% if you're over the age of 70. Now in 2012, means testing was introduced, which meant that higher income earners receive a lower rebate on their insurance. And then a couple of years later, in 2014, rebates were indexed to the rate of inflation. So this led to a decrease in the subsidy of your premium. Now we saw on the previous slide, the premiums are going up by almost double the rate of inflation. However, your rebates, well, they've now been indexed to inflation. So as inflation goes up, so do your rebates. However, cost of insurance is going up faster. So what this means is that your 30% rebate, well, it's now a bit less than 30%, isn't it? Because it's going up at inflation, cost of insurance is going up even faster. From April 1st, 2025, the base tier rebate will be slashed to just 24.288% for those under 65. A far cry from its original 30%. And of course, note, that's the base tier. If you're on a higher income, your rebate's going to be even less. Can you see how that carrot, that nice juicy fat carrot, 30% that we're just going to pay for somehow out of your taxes? That carrot, well, it's not looking as fat and juicy as it used to, is it? So what have we got here? Rebates. So rebate from 1st April, 30th June 2025. If you're earning less than $97,000, 24%. Between $97,000 and $113,000 income, 16% rebate. 113 to 151, the rebate is only 8% for you. And if you're lucky enough to be earning over 151,000, no rebate. That carrot, poof, it's gone. There's no more carrot. What about the stick? You think the stick is still there? So let's have a look at the stick. If you do not take up private insurance, and if your income is above a certain threshold, you will incur a Medicare levy surcharge, which is an extra 1 to 1.5% of your taxable income. That's the stick. Now, we've got to clear something up here because the Medicare levy surcharge is different to the Medicare levy, okay? The Medicare levy surcharge only applies to those without private health insurance and who are on a higher income. However, all taxpayers above a very low threshold must pay a Medicare levy of 2%, whether they have private health insurance or not. So this is one reason why when you submit your tax return at the end of the financial year, you might actually get a bill from the tax office and discover that you owe them money. Because the Medicare levy at 2%, that is not included in the tax that your employer withholds out of your wages. So if the tax that you want to get back, that you think, throughout the year you've paid too much tax, whether it's through a change in jobs or through the deductions that you want to make, if the money that the tax office owes you through those deductions and so on, if that's less than 2% of your taxable income, you're going to be hit up with a bill to pay more money. That kind of takes the shine off of doing your taxes, doesn't it? No wonder some people put it off. How much is this Medicare levy? 2%, right? Well, average salary in Australia, $72,000. So that means your Medicare levy is $1,440. Ouch! That, to me, sounds like quite a big bill. No wonder people try to deduct everything they can think of. Now, the Medicare levy, as its name suggests, is used to fund our public health services, i.e. Medicare. All right? Notice, everybody has to pay the Medicare levy. Even if you have private health insurance, you still have to pay that 2% of your taxable income. Everybody. So having insurance does not get you out of the Medicare levy. Now, the Medicare levy used to be 1.5%. In 2014, it was increased to 2% to help fund the NDIS, the National Disability Insurance Scheme. And the NDIS, I have got to tell you, what another example of a catastrophic government failure. The NDIS is a budgetary black hole that is sucking in money like a Death Star. And I think we're going to hear a lot more about this in years to come. So Medicare levy surcharge thresholds. Who has to pay the Medicare levy surcharge? What does this higher income mean? So we can see that if you're earning, actually let's look at the financial year 2026, because there's a lot of people are going to be watching it as this is coming up. You've got to be earning more than 101,000. If you're earning less than 101,000, you don't have to pay the surcharge, okay? If you're earning 101,000, you've got to pay 1%, and then it goes up. If you're earning over 150,000, you've got to pay 1.5%. Now, that's if you're a single person. If you are a couple, if you're in a relationship in the eyes of a tax office, the threshold kicks in at 202,000 for your combined income. So how does this compare with what most people earn? So the mean average salary in Australia, it's actually bang on that threshold, bang on where the Medicare levy surcharge applies at approximately 101 or 102,000. Now notice I've put there the mean average salary and the median average salary. Now if you don't understand the difference between mean average and median average, well, this is another great plug to enroll in HOM 102, because we'll give you a great introduction to statistical analysis. It's more fun than it sounds, okay? But we do cover mean and median average. I'm going to quickly explain it and show this to you here. So let's have a look. Person working at Woolworths, stacking shelves. Okay, their income for the year, approximately 42,000. And the second line from the bottom there, the Woolworths CEO in financial year 2023, Brad, he's no longer with Woolies, 8.5 million. 42,000 if you're stacking a shelf, and 8.5 million if you're the CEO, which is quite interesting because our shelf stacker, they could work their entire life. They could work 50 years, 40 hours a week, 52 weeks a year, no holidays, and in 50 years of hard work, they would earn less than what their CEO took home in a 12-month period. I think it's kind of interesting. Now, why am I talking about this? Well, remember we said there's a mean average and a median average, okay? So the mean average is going to be moved by people like Brad, all right? Now, would you agree that you meet more shelf stackers than you do CEOs? Typically, there's more of them. It's like a pyramid, all right? So this is why we want to look at the median average salary. So mean average salary, 102,000. However, the median average salary, which is a much more accurate figure in this context, median average salary in Australia, average punter on the street, 72,000, below the Medicare levy surcharge threshold. What I'm trying what I'm trying to get at here is that most people, statistically, most people, most income earners, most taxpayers in Australia do not have to pay the Medicare levy surcharge. It does not apply to them. It only applies to people who are earning a bit more than average. Now remember, if you're in a relationship, in the eyes of a tax office, it's your combined income. So let's say we've got somebody on a pretty good wicket. They're earning $125,000 a year, and their partner is they're also working full-time. They're getting an average salary, $70,000 a year. Between them, their pay package is $195,000 a year. They're still underneath that threshold. Okay, $195,000 a year for two income, I think that's pretty good. Yeah, they do not need to take out health insurance to avoid paying more tax. Okay, so let's say you are earning a bit of money, right? And the surcharge is going to apply to you. So you're going to look for ways to get out of paying that tax by taking up insurance. So I went to comparison website Compare the Market, and I pretended to be Martine, a 30-year-old single female with a salary of $110,000. So if I do not have health insurance, I am going to be liable for the Medicare levy surcharge, which is 1% of my income, which is $1,100 a year. So I want to get out of paying that $1,100 to the government. I'm going to take up insurance. All I'm interested in, because I'm 30, not worried about health that much. I'm still partying. I just want to get rid of this tax bill. I'm going to take out the most basic cover I can. Limited hospital cover, no extras, okay? I'm going to spend more on insurance than I would if I just paid the surcharge. Is it worth it? Well, if I do go to hospital, I'm actually going to be hit up with a $750 excess, so I'm going to be paying almost $2,000 just to get out of paying an $1,100 surcharge. So that's not really a great deal, is it? All right, supposing I'm a 30-year-old single female, but I'm thinking, well, I'm going to need assisted fertility, okay, which is quite common these days. So my surcharge would be $1,100. If I add assisted fertility to my insurance policy, only one came up on the comparison website. That was going to cost me almost $6,000. So that's a pretty big hike. Now, funnily enough, if I did not have private health insurance and I did my assisted fertility via the public system, I'd probably be out of pocket for around about $2,000. Okay, so $2,000 plus that surcharge, out of pocket, let's call it $3,500. If I spend the money on insurance, I'm out of pocket. When you take into account the fact that insurance is not going to pay for 100% of it, I'm going to be more than $6,000 out of pocket. Okay, now Martine, right? She's like, bugger it. I'm not going to have assisted fertility. I can do this myself. But if I'm going to have insurance, I want more than just basic hospital, I want everything. I want to look good. I want to feel good. I'm going to add dental, optical, physio, massage, chiro, acupuncture, psychology, lifestyle. I'm going to go crazy. I'm going to get as much health as I want because I want to get my money's worth from my insurance, okay? Now, at this point, the insurance starts to look a little bit more attractive because we've got a quote here for $1,400, and that includes $180 of optical a year. If Martine goes to see the physio, she'll get $34 back off her first consult, $26 off her following ones, up to the tune of $200. If she gets a massage, she'll get $23 back, up to $200 per year. If she sees a chiropractor, she'll get $34 back, up to $200 a year. Acupuncture, $18 a session. Psychology, not much. $53 for your first session, $34 for your second, and a cap of $100. So those mental health issues, they're going to have to look after themselves because I'm not going to get much money back on that. And lifestyle, whatever that is, according to the health fund, up to $100 a year. So it's starting to look a little bit more attractive at this point if you're a higher income earner and want to avoid the surcharge. But you're still going to have to pay $750 more if you go to hospital. Now you might think, okay, those figures look all right. Health insurance, it's a better deal than the surcharge. However, PPPS, most people are paying a lot more than what you see on the screen. And we'll see how much more a bit later on. Oh, did I mention there was another stick? Carrot and stick. Well, why have one stick when you have two sticks, right? Let's really motivate these people to take up insurance. So the second stick is lifetime health cover loading. Now, guys, if you're watching this and your eyes are starting to glaze over, well, please stick with me because here's where it gets good, okay? So, here's our second stick. If you do not take up private health insurance before the age of 31, it will be more expensive if you decide you want it in the future. So, you're 30, maybe you're still partying a bit, insurance, whatever, it's like superannuation. Don't have time for that, Well, according to the government, 30, time to grow up, Take out insurance or else. So the lifetime health cover loading, how does this work? Well, there's an increase of 2% on your premium for every year that you did not have private health insurance after the age of 31, up to a maximum of 70% more expensive for a period of 10 years. And by the way, that carrot does not apply to this little stick we got going on here. Rebate does not contribute to that loading. P.S. This stick is scary bogeyman nonsense, and I will show you why. This graph you can see here, this blue line, this is how much you're going to spend on insurance depending on what age you were when you first took it up. So remember, the government, they want you to take up insurance at the age of 30, otherwise they're going to hit you with a stick, okay? But what you can see on the graph is that if you took it up for the first time that you were 50, even though you're being hit with that stick, you're going to pay less overall than the person who took it out 20 years earlier. If you want to check this out, there'll be a reference in there. You can go to that page and download a spreadsheet and put your own numbers in, play around with it. You'll find this holds true. Now, Ross Gittins is probably Australia's most famous economist, and he calls this a con trick on the innumerate. I've got to tell you, innumerate, you do not need to be a leading economist or a genius mathematician to work this out. It is dead simple, and I'm going to show you exactly how nonsensical this is. All right, very simple here. We're going to keep things simple. We're going to keep things conservative. We're not going to put up prices over time. We'll keep the maths nice and easy. Supposing your insurance costs you $1,000 a year. Remember, it's actually going to cost you a lot more, but we'll stick with $1,000 to make the maths easy. Okay, $1,000 a year for insurance. The stick, 2%. Well, what's 2% of $1,000? It's $20, all right? So let's say you take out insurance for the first time at the age of 45. That's 15 years of loading, okay? Well, 15 years times that $20, $300 a year. So that's how much you're going to have to pay extra on your premium. So instead of your premium being $1,000 a year when you take it out for the first time at 45, it's now going to be $1,300 a year. So the penalty is going to apply. You're going to be hit with that stick for 10 years as punishment for not taking insurance up when you were 30. All right? So 10 years, paying that extra $300, you're going to pay an extra $3,000 overall. Now, how much would you have paid if you actually took the insurance up at the age of 30? Well, for that 15 years, up to the age of 45, well, you would have paid 15 years at $1,000 a year. You would have paid $15,000 versus $3,000 extra if you took it up later in life. $15,000 or $3,000. It's a net difference of $12,000 extra that you have spent on insurance just for taking it up at the age of 30 instead of later. All right, $12,000 a year. If we stick with this example and we say that you took out insurance for the first time at the age of 45, 15 years later, well, $12,000 divided by 15 years, $800 a year. What would that look like for you? What would you spend $800 on to keep yourself healthy? Now, if you're thinking at this point, well, $800 is not much, it's only about 6 massages, okay? Remember, the person that paid for the insurance, their insurance is not paying for those massages. It's paying for $23 for every massage, all right? They're still paying their insurance, and they're still paying most of the cost of that massage. So, I hope you can see how nonsensical this is. To be clear, I'm not saying that you should not take up health insurance because of this. What I'm saying is that this should not even be any part of your decision making as to whether you should take up insurance. There are many reasons why you might want insurance. It might be because of your age, it might be because of your health status, you might want to consider how likely you are to incur large medical expenses in the near future. You might want to consider whether you've got kids, you might want to consider how much money you're earning and if you have to pay that surcharge, if you're earning more than average. You might consider how much money you've got in the bank to cover yourself if something bad does happen, rainy day, you know. You might want to consider your risk profile. So all of these are valid questions to ask yourself in deciding whether or not you want private health insurance. What is not a valid question about whether you want it today or not is whether you might want it at some point in the future. That is completely irrelevant because what lifetime health cover loading is asking you is this. Would you spend $1,000 today on something you do not want to avoid spending $20 in the future when you do want it? $1,000 today for something you do not want, $20 in the future extra when you do want it. 100% today, 2% in the future. So can you see that this stick, it's not even a stick. It's more like being flogged with a piece of soggy lettuce. That's what Keating said about Howard, who was a genius that came up with this scheme. Now, this stick, this piece of soggy lettuce, okay, you would think that it's so obvious when you look at these figures. Nobody could possibly fall for that, right? Now, I'm sorry, if you did fall for this, do not be embarrassed because you are not alone. Let's have a look at this. This blue line, this shows us insurance coverage in Australia for health over the decades. And what we can see is that it was declining until John Howard came along and thought that everybody needed more private health insurance. Now, when the levy care surcharge was introduced, it kept declining. There was a little bit of an uptake when this carrot was introduced, the 30% rebate. But the big uptake, that near vertical line that encouraged so many people to take up insurance so quickly in the year 2000, that was when the lifetime health cover loading was introduced. So all these people who took up health insurance, they all did that at the time when this stick, that's not really a stick, came into effect. Isn't that amazing? So Ross Gittins, our famous economist, he's written a lot of articles about private health insurance, and he doesn't mince his words in this article in 2018, which he titled, "Private Health Insurance is a Con Job." This is what he has to say. This is speaking more from a macro society level than it is an individual level. He says the more you do to make insurance affordable, the easier you make it for the people running the health funds, the owners of private hospitals, and the surgeons and other procedural specialists who work in hospitals to raise their prices and fatten their profits, which the pollies fully understand. Many people buy insurance to avoid waiting times for elective surgery. But if private insurance didn't exist, surgeons would have to earn more of their income from public hospitals and waiting times would be shorter. It creates the problem it purports to solve. Now, Ross Gittins wrote that article in 2018, but it didn't take him 20 years to figure this out. He figured this out pretty quickly. This is from the year 2002, I think. So there was an increase in private health insurance in the year 2000, as noted previously, from 1999 to 2001, very short period of time. The cost of healthcare increased by 18%. And almost 60% of that increase was the cost of rebates to private companies. Hospital visits rose 7%. 1% to public hospitals, 6% to private. So why did this happen? Well, we can speculate, but possibly all this government money, all of a sudden everybody's got private health insurance. Maybe doctors are a little more quick to recommend that you get something checked just in case, get a procedure done. Maybe patients are more likely to visit hospital because they feel like they want to get something back for the money they're spending on their insurance. Who knows? So, private health insurance. John Howard introduced it, remember? His reason for introducing this, relieve the burden on the public health system. Did it work? No, it didn't, because wait times and visits to hospitals increased. This chart shows you how much they increased. You're looking at the bottom line there. That shows median waiting time for all procedures. I actually think if you took all the other stuff off that chart, that line would look a bit more steeply inclined. So is private health insurance really worth it? You might now be questioning your existence. Should I really have insurance? Well, let's have a look at, why do people take up insurance on an individual level? Is it worth it, So what are the benefits of private health insurance? Well, a common cited benefit is that, you get to choose your own doctor or your own surgeon or specialist, And it's funny, isn't it? Because it's not really like choosing what car you're going to buy. There's no comparison website that says, oh, look here, Dr. Wild got 4 stars, but Dr. Savage only got 3 stars. How do you know which doctor you're going to choose? That's, oh, by the way, even if you happen to know somehow, oh, this person's really good, he gets a 5-star review, okay? The health fund, well, they might say, oh, no, sorry, that person's not on our list of providers. You can only choose from the ones we've got. Okay, so touted benefit, reality, not quite there. Another benefit, possibly, may help to cover services not available under Medicare. Well, yes, that is true. Not everything's available on Medicare. However, private insurance does not cover going to see a GP. It does not cover you if you end up in casualty. And it also doesn't cover pathology. Another possible benefit, you might get a private hospital and a private room. Well, that sounds pretty nice to me. I've got to admit, if I had to go to hospital, I'd probably rather have my own room. Okay, so a possible benefit there. And did you know some people in a public health system, they still end up in a private hospital, in a private room? Shorter wait time? Possibly. Might be a shorter wait time for you. However, a lot of insurance policies, they've got a built-in waiting period of 2 months. Might include ambulance cover. Potentially, if you think, I don't know how many times have you ever ended up in an ambulance in your life? Hopefully not many. But if you do need an ambulance, well, your insurance might cover the cost. If you're a resident of Queensland or Tasmania, thankfully, we don't have to worry about that, but other states, ambulance cover is an issue. Reduced cost, question mark. Well, I really do question that one. A couple of reality checks here. Out-of-pocket expenses. We saw earlier, $750 excess. Whatever you go to hospital for on private, $750 before anything even happens. Okay, so that's the excess. Then there's the gap. There's a difference between how much your insurer is going to pay and how much your doctor, specialist, or whatever charges you. So I think that some people, they think, oh, it's okay, I've got private health insurance, okay? Insurance, in most cases, it's not going to be paying for 100% of whatever's going on. You're still going to have to pay something on top of the money you've paid for your insurance. And then health funds, pretty famous for complicated fine print and hidden surprises. Do you think that's a baseless accusation? Well, in the year 2023, the ACCC received a record 3,500 complaints about private health insurance. And allegedly the health funds in that same period reported a 110% increase in net profit. Are the two related? I don't know. It just shows you on the slide there. Those are the sort of things people are complaining about. Out-of-pocket costs for private hospital cover have risen by 71% in 5 years, leaving numerous Australians paying more for their healthcare despite having insurance. Undisclosed gap payments, where patients only find out their costs after treatment, have soared dramatically from $418 to $685 on average. Such unpredictability makes it incredibly hard for everyday Australians to budget for their healthcare. So take a step back for a moment. Where are we at? Okay, so you got private health insurance. You're still paying the Medicare levy, which is 2% of your income. You're paying for your private health insurance, which is going up at almost double the rate of inflation. And the maximum rebate you're going to get from the government is 24%, if you get one at all. And you're also going to have to pay for any gap that the private insurance doesn't cover. Is it starting to sound to you like you're paying for something 3 times? Oh, and guess what? In an emergency, it's not going to make the slightest bit of difference, because you're going to get picked up by the same ambulance, you're going to get taken to the same hospital, and you're going to get treated by the same doctor. You know, people think private health insurance, I need it in case something bad happens. Well, if something really bad happens, thankfully in our society, you're going to be looked after anyway. So is private health insurance one big scam? Well, the Medicare levy before private health insurance rebate was introduced was 1.5%. And the Medicare levy after private health insurance was introduced was still 1.5%. So all those people that took up private health insurance, well, we're still paying, and they are still paying that 1.5% levy. Still collecting that money. The Medicare levy after 1st July 2014 increased from 1.5% to 2%. The rebate was 30% if you're under 65, and now it's anything from 24% down to even 0%. And meanwhile, the cost of private health insurance premiums have almost doubled faster than the rate of inflation. So we're paying more, but are we receiving more? And meanwhile, in the background, the NDIS is consuming an ever-increasing proportion of our taxes. So putting rebates aside, is private health insurance on the whole good policy? Well, there's arguments for, arguments against. Case 4, it encourages responsibility and ownership for your health. It encourages people to be proactive in their health, possibly. Does it reduce the burden on the public purse? Well, we've seen that no, the opposite happened. Does it encourage health funds to be competitive with each other? Maybe. Is the private sector more cost conscious than the public? We usually find that publicly run organisations are inefficient compared to private organisations. However, we also find that when something becomes privatised, usually being private, they're going to look for ways to cut costs in whatever way they can, which means we often experience a decrease in the quality of the service being provided. So that's a whole other debate. What about the case against health insurance? Well, we're putting public money into private businesses. Maybe we should be investing that money in public health. Dare I say it, maybe we should be investing more in complementary medicine, which has a much, much better cost-benefit ratio to modern medicine. Will all of this lead to a longer-term decline in the quality and availability of public health? Who knows? And those most in need of healthcare might be the same people who can't afford it. That's a whole other ethical debate. So thank you if you've stayed with me so far. I know there's been a lot to take in here, okay? What we're going to do now is look at the history of health fund rebates, specifically for natural therapies. So this might be the reason you were watching this presentation in the first place, okay? If you skipped ahead to this, welcome back, by the way. If you stuck with me for the last whatever it's been, thank you and well done. So here we go. History of health fund rebates for natural therapies. So rebates for most natural therapies were removed in 2019. This upset a lot of people in the complementary medicine profession. The research funded by the NHMRC was heavily flawed and biased. It cast doubt on the entire efficacy and validity of complementary medicine. They concluded that nutrition works, but naturopathy doesn't. Don't ask me how that is possible. They also concluded that Western herbal medicine doesn't work, even though it forms the basis of a lot of pharmaceuticals. It was argued that removing these rebates for natural therapies would reduce the cost of the premiums. Well, obviously it hasn't, because premiums keep going up. Rebates for complementary medicine do encourage people to be more healthy. And of course, money spent on complementary medicine leads to increased health, which leads to decreased healthcare costs overall. So you can see why a lot of people got pretty upset when these rebates were removed. Now, this slide, okay, it looks very bland, okay. This slide is actually very important. This is a key to the whole piece of this particular puzzle, all right? If private health insurance truly was private, health funds themselves could decide how to encourage their members to be more healthy and therefore save the fund money, e.g. through giving rebates for complementary medicine, okay? Just think about it. You're a health fund, you're an insurer. You know that the healthier your clients are, the less likely they are to make an expensive claim. So what can you do to encourage your clients to be healthy? You could rebate complementary medicine. Unfortunately, because health funds are receiving money from the government, they kind of have to do what the government tells them to. The only reason the government gets to decide whether they can offer rebates for complementary medicine or not is because of this taxpayer-funded rebate on the premiums. So, the government pressures people into private health insurance. It allows these companies to increase the cost of the insurance by almost double the rate of inflation, and then they remove rebates for complementary medicine, which we know produces better health outcomes and is more cost effective. You could be forgiven at this point if you thought this is some kind of big conspiracy. So, obviously it's upsetting. The rebates have gone. Did it make a big difference to us as practitioners? Well, I've asked a lot of people this question, okay, and I've received a lot of different answers, because some people have said to me, yes, fewer people booking in, people not coming back, downturn in business on the whole. Other people have said to me, not much, didn't really notice the difference. So my little theory is, maybe it was similar to the introduction of the GST in the year 2000. Suddenly everything was a little bit more expensive. Short term, decline, and then longer term, the market just adjusts to what they actually want to spend their money on. Funnily enough, nutrition has remained as a rebate. Health funds can still offer a rebate for nutrition. What do the nutritionists think? It doesn't make any difference. I can tell you, as a college, we're not inundated with people enrolling in nutrition just for that rebate, okay? When Switch On Health first started, funnily enough, in 2019, same year that these rebates were removed, we did initially receive a number of inquiries about people stressing about the removal of the rebates and thinking, well, I've got to get qualified in nutrition because I want to keep offering that rebate, okay? Those inquiries, they died off pretty quick. We didn't have any after a period of 12 months. So did it make a big difference to practitioners? I don't know, I think not, but some people are obviously going to tell me that it did. Let's have a look. We had the COVID scamdemic in 2020. We had the inevitable cost of living crisis that followed. We've had an annual increase in health insurance premiums. The threshold for the Medicare levy has been going up, and we've also had inflation, coupled with wages not going up by as much. So, 6 years ago, the world was a different place. Will the return of rebates be a sufficient incentive for people to either increase the amount they're paying to include extras, or take up private health insurance for the first time, or start a new policy if they previously let their policy expire? I don't think so, but we're going to break each of these down, okay? So let's have a look at the COVID scamdemic. So I think that this has, on the whole, led to a decline in the trust of mainstream medicine and an increased interest in complementary medicine. So if rebates come back for complementary medicine, will this further fuel an increase to CM practitioners, or will the impact be negligible? I don't know. You would think that if more people are interested in CM and if they can get a rebate from it, maybe that will be good for our business, but will it make a big difference? Who knows? What about this inevitable cost of living crisis? Okay, well, in my opinion, it's unlikely that we're going to see an increase in extras cover or an increase in the uptake of health insurance in general. Throughout this scamdemic, there was an initial drop in early years and then it kind of rebounded again. Health insurance, highest among those who are older, 75 to 79. Younger people, 25 to 29, lowest age group for holding health insurance. APRA data from 2024 indicates, on the whole, insurance has been sustained. However, people are downgrading their cover. And there's a bit more information for you there. 15% dropped or reduced their cover during the pandemic. Nearly a third of Australians aged 35 to 44 reduced or dropped their insurance, and a quarter of those aged 25 to 34. This is why we see news articles like this. Between 2020 and 2023, more than 400,000 people downgraded from gold. So we know that people, because of this cost of living crisis, which I think is something else, we know that they're looking for ways to save money and reducing their insurance as a result. Annual increase in health insurance premiums, almost double the rate of inflation, as shown earlier. Premiums are going up, rebates are going down. So we don't think that there's going to be more insurance taken out. More headlines. Private health funds slammed for price gouging. In this particular example, this is HCF. They're being investigated for what is called phoenixing. So what they do is, let's say you're on an insurance policy, they cancel that policy, no longer exists, we're going to put you onto a new policy. The new policy, it looks a lot like the old one, but it's more expensive. Dodgy practice, right? You can see I've highlighted at the bottom there, jacking up premiums by up to 35%. 35% more for your health insurance. Remember, okay, so we said earlier when we were looking at the Medicare levy surcharge, and remember Martine, our single 30-year-old female who didn't want assisted fertility, and she could pay $1,400 and get all of these wonderful extras, okay? $1,400, well, that's kind of okay. Well, guess what? Most people are paying a lot more, okay? Here we go, average figures. Health insurance for singles. For young people, almost $3,200. If you're an established person, I don't know what that means, maybe it's me, $3,700 a year, and mature people, definitely not me, for more than $4,000 per year. That, to me, is quite a lot of money to be spending on health insurance when I could be spending that money on staying healthy instead. But that's just me, okay? That's exactly the same information in a different format if it helps you to read it that way. The threshold for Medicare levy surcharge is increasing, okay? So remember, some people, they want to take out insurance to avoid paying more tax, all right? However, that threshold at which you're going to pay more tax, well, that's going up. Are wages going to keep pace, okay? What we're saying here is that if the Medicare levy surcharge is increasing faster than wages, fewer people over time will be hit with the surcharge for not having insurance, therefore there's less of a reason for them to take it out. And we've got the figures for the surcharge there. In 2023, it was 90,000. 24, 93,000. 25, 97,000. And next financial year, 101,000. Remember, the average salary in Australia is currently at about 72,000. Most people do not need insurance to avoid the Medicare levy surcharge. I've shown here the increases. Every year, the Medicare levy surcharge has gone up. All right, now, for the sake of completion, there was a period from 2015 to 2023 when it did not go up at all. So over that time, more people probably would have had to take it out as their wages increased and they ticked over that threshold. But as we can see at the moment, the threshold is increasing each year, which means we're not necessarily going to get more people needing it to avoid that threshold. We've had inflation coupled with lagging wage growth. This one says wages are growing faster than inflation, but workers are $8,000 worse off than 3 years ago. That's from just a few months ago, so that's current data. Here's what it looks like on a graph. This blue line, that's the one you want to be looking at, employee cost of living. So what we can see is that if somebody was on a salary of 90,000 a few years ago, just in the space of 3 years, their purchasing power has dropped by $8,000. Quite a lot. Are they still interested in holding their health insurance? I don't know. So here's my theory, okay? The declining, popularity of private health insurance. Rebates removed in 2019, COVID scamdemic in 2020, inevitable cost of living crisis that followed, annual increase in health insurance premiums, threshold for the surcharge keeps going up, while inflation also keeps going up and wages not going up by as much. So my theory, okay, is that private health insurance would be not so attractive now. The only person to think that private health insurance is less attractive, because there's a lot of stakeholders in the private health insurance industry who describe it as a death spiral. Pretty vivid imagery, right? So there's a lot of people in the private health insurance, they're kind of worried about their future. They can see the writing on the wall, and they're going to do everything they can to make sure they keep getting that rebate from the government. Now, surprising to me, in the context of everything I've talked about in this presentation, you might at this point be asking yourself, why would anyone have insurance? You know, it is surprising to me that almost 55% of Australians still, in the context of all this, they still have extras cover. What about the health funds themselves? Okay, what are the health funds going to do? Are they going to look for ways to save money? Remember, the health funds are in that death spiral, all right? So are they going to not offer rebates? The government might say, you know what, guys, you can now offer a rebate for naturopathy if you want. Is a health fund going to take them up on that? I don't know. Are they going to advertise them to try to attract more members, but then restrict how much they actually pay out, or restrict who they recognise as a provider? And funnily enough, like we said before, you know, health funds at the moment, they can offer a rebate for nutrition if they want to, and not all of them do. For example, Bupa and HCF, pretty large health funds, I think you'll agree, they do not offer a rebate for nutrition. So the Health Minister has accepted recommendations to include naturopathy in Western herbal medicine, okay? So we think, given that the government's been re-elected, that these rebates will be approved for naturopathy in Western herbal medicine. On the whole, I think health funds are likely to add them back to their extras policy because they want to keep customers. So the next question for you becomes, well, if I'm studying with Switch On Health, or I'm thinking about studying with Switch On Health, will I be recognised as a provider for health fund rebate purposes? Well, we don't know. Here are some scenarios. The government might say, well, if you're accredited by ATMS, that's good enough to be a health fund provider. I suspect this is unlikely because we're not delivering courses that are regulated in any way by the government. Now, whatever the government says about who can be a provider and who can't, the health funds themselves, they've got a history of making up their own rules. There's a pretty famous example here. So Medibank, they changed the policy for massage provider status in 2013, and they set their own standards which were beyond the standards of the qualifications that were regulated by the government. Something else the health funds have got a history of is not recognising people who studied wholly or mostly via distance learning. This has always been a big bone of contention for me because I've done a presentation for ATMS on this. It is my belief that people who attain their qualifications via distance or online learning, they often work harder and are more highly trained and qualified than people who studied in a classroom. That's a whole other discussion, but it hasn't stopped the health funds from discriminating against people who studied via online learning in this day and age. So my little conclusion here, we do not know yet, but I suspect that Switch On Health graduates are unlikely to be recognised as providers by the health funds for the purposes of giving rebates. So your next question has to be, well, What's the impact of that? How is that going to affect me in my future business as a practitioner? So the government's got to approve the rebates. Your client has got to have private health insurance, remembering that Medicare levy surcharge threshold is above the average income. Not just health insurance, but they've got to be paying for extras. The health fund themselves, well, they have to offer a rebate for that service, and that particular policy would have to include a rebate. The health fund's then going to apply its discretion over who it can recognise as a provider. Maybe they've only got some people on the list. And then, after all of that, if you're charging $180, maybe your client's going to get about $25 back. So, look, is this going to make a big difference to you as a practitioner? Well, personally, I do not think so. But you're going to be asking yourself this question. Well, what if the person around the corner can offer a rebate and I can't? Is that going to put me at a disadvantage? Am I going to struggle as a practitioner while somebody else is booming? I don't think that's going to happen, okay? And there are many, many different ways that you can manage this. Here's just a few suggestions, okay? What if somebody phones you up and they say, oh, do you offer a rebate? No, okay, I'm not coming. I'll tell you what, I'll discount by $25 because I'm very confident that I can help you and I'd hate to see you go somewhere else and not benefit from my services. Personally, I don't like discounting, but look, that's one simple answer. You can focus on the value or the benefit that you offer. You could explain to people, look, getting something for cheaper doesn't necessarily mean it's better. We're talking about your health here, okay? You could add something of greater value. Who knows, a course, an ebook, whatever it might be. You could offer packaging, bundles, plans, 6-month wellness package, 2-month health starter pack, whatever. Tiered service, silver, gold, platinum, which one would you like to be? I like this one. Nail your niche, okay? If you are seen as the expert in a particular area, and that could be geographical area and or health area, okay? If you're seen as the expert, people will come to see you, not the other person. They're not going to care, I don't think, about that $25 because they want results. They would rather spend $150 on great results than $180 on average, all right? What else can you do? Well, you can upskill. You can offer more than other people, okay? And there's lots of ways to do this in our profession. You can build good networks, good referrals, and make sure that other health professionals and anybody out there is referring business to you. You could offer incentives for your clients to spread the good word and help grow your business for you. Well, here's a radical thought. You could get your clients to watch this video and explain to them maybe they need to have a second thought about, did they actually need that private health insurance in the first place? What is it costing them? Now, it's not about the money, okay? It is about how you market and present yourself. And when somebody contacts you and they make an inquiry, chances are they have been looking and they've compared you to other people already, okay? When they fill out that form or when they pick up the phone and call you, they've basically made up their mind that you are the person they want to see. And all they're looking for is confirmation. So if Switch On Health graduates are not recognised, who might be? Now, this is the big unknown. Will existing practitioners be recognised? Will it be all existing practitioners? Will they be grandfathered? Will it be similar to what we saw in the past, where the health funds discriminated against people who had completed their studies via online learning? Will it be the case of, well, we'll recognise bachelor qualified people but not advanced diploma? We don't know. What if a person that did the bachelor did 2.5 years of their course online? Are the health funds still going to apply that level of discrimination? We really don't know. This is why when I see posts on social media out there and people are making these very bold assertions, yep, health funds are coming back, this is when they're coming back, you'll be able to get them, you won't. Well, that's nonsense. There's so many variables here, so many unknowns. We are yet to see how this plays out, okay? But what if? I mean, this is a question we get sometimes at Switch On Health. Bachelor versus advanced diploma. Okay, what's the difference? What if bachelor people are recognised and they're able to give rebates and advanced diploma people are not? Okay, what if? Is it worth you doing a bachelor? If you do nutrition or herbal medicine, it's going to cost you approximately $30,000 more. If it's naturopathy, approximately $50,000 more. So do you want to spend that much more money to be able to offer a $25 rebate? Now, I'm not going to draw that conclusion for you, okay? All I want to do is arm you with the information you need to make an informed decision, all right? And I'll support you in whatever you decide is best for you. I've got no judgment or opinion on this. You just have to look at these figures and make up your mind for yourself. And if we're talking about homeopathy, well, homeopathy rebate is not recommended. It's not coming back at this point in time. So it's a completely irrelevant discussion. Nobody gets to offer a rebate for homeopathy, no matter who they are in Australia. All right, so believe it or not, we're now at the end of this presentation. So thank you so much for watching. I'm going to do a recap, okay, because I think there's been a lot of information here. We really need to just summarize what we've learned, okay? So here we go. Rebates funnel money from the public purse to private businesses. Health funds pay you less than you pay them. Money spent on complementary medicine has a better cost-benefit ratio to the medical model. Private health insurance has failed to relieve pressure on public health. The Medicare levy has gone up despite more people having private health insurance. Insurance premiums have gone up faster than inflation, and inflation has gone up faster than wages. Rebates, the carrot, have gone down. Wages are growing slowly, while the Medicare levy surcharge threshold is increasing. Lifetime health cover loading is a baseless scare tactic. Supposed benefits of private health insurance are questionable, with out-of-pocket expenses and complaints increasing. Rebates for naturopathy and Western herbal medicine are likely to return. Health funds may start to offer them again. Switch on Health graduates might not be recognised as providers. Other graduates unknown, and this could vary from one health fund to another. The impact, in our opinion, is unlikely to be significant. So, thank you so much for sticking with me to the end of this presentation. I know it's been long, I know it's been mammoth. I hope that you've learnt from it. I hope that there's been some real eye-opening moments for you here. I will put a link to the slides below. Here are the references if you would like to see them. And here are more references, and here are more references, and here are more references, and more references. Check them out if you want. Thank you again. Thank you for watching this. I do hope you enjoyed it. If you learnt something from it, if it brought a little smile to your face, my job is done. So sincere thoughts. Thanks from the bottom of my heart. Namaste, and learn more with Switch On Health.